Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit system of post-acute healthcare services, including long-term care, short-term rehabilitation, independent living, assisted living, memory care programs, and hospice services available to our neighbors and families here in the Berkshires and beyond. I'm your host, Rachel Colosino, and my guests for today's show are Julie Frost and Nora Warfield from Fairview Commons Nursing and Rehabilitation Center in Great Barrington, and Pat Tremblay from Berkshire Visiting Nurse Association. Welcome, ladies.
Thank you.
Thank you. Thank you for being here. So March is National Social Work Month, and so today we're going to discuss the incredible and life-changing work that's done by social workers. And as part of that, we're going to also discuss a pilot program between Fairview Commons and Berkshire VNA that works to coordinate care in a really integrated and revolutionary way. So we'll talk about that. It's a unique program that's helping patients become stronger quicker. But first, though, I want to start with the basics. Nora, what do social workers do, and what does your job include?
Our social workers are basically advocates for patients in a nursing home. We help facilitate family meetings, making sure that their resident rights are being upheld, and just being a support system to the residents and their families.
So you really help residents adjust to the facility as they work to move in?
Yes.
Okay. And I understand, too, that you have a role specific to discharge planning. So you're also a support to the residents through that process as well?
Yep.
Okay. And Julie, what about you? Your role as a social worker is a little bit different. Can you tell us about that?
Sure. I work in the long-term care. I really help people transition when they first come in, and anything they may need in order to adjust to make that place more of a home-like environment. I consider myself a tour guide to long-term care, as it is a large culture and it is something different than people expect. Hopefully they view it as positively. But I'm there to help with any questions that they may have.
What do you mean by a new culture for people?
It really is a different world, starting with Medicare and Medicaid and the billing and everything that entails. I try taking the knowledge that I've acquired and continue to learn and simplify it into a language that everyone can understand, and try to pass along that information so it's not as confusing and is for continual care and to make their lives easier.
Okay. And so, Pat, can you tell me about your role and how you work with Julie and Nora as social workers?
Sure. I'm in charge of the Berkshire Visiting Nurse Association, so more of our staff work very closely with these two women. But our services from the VNA try to pick up the warm handoff from Fairview Commons when the residents are ready to go back to their homes. So we work very closely to make that transition a very safe and effective one that will allow people to stay home for as long as possible. There is a lot of communication that happens between our staff. We have a care transition specialist who is at Fairview Commons on a daily basis. She participates in family meetings. She meets with patients who newly come to Fairview Commons but have a plan to go home later on. So we get to know the residents and their families before they're ready to come home. If we had to, we could do an assessment in the home even before the resident got home to make sure that they would have everything they needed. Our nurse works closely with the staff also to look at medications, make sure, working with Nora, that everything is in place at the time they need it. So if they need a visit at a particular time when they come home, we can make sure that we're there on time. Our services are accredited by the Joint Commission. We're also certified for Medicare and Medicaid it's actually the Department of Public Health working on behalf of the federal government and the state government. And I'm very proud of our staff. I think they do a very good job, and we've been awarded for the third year in a row Home Care Elite status, which means that our organization is in the top 25% of home health agencies nationally. So
Congratulations.
Thank you. We cover all of Berkshire County. the entire county. We're available 24 hours a day, 7 days a week, 365 days a year. We're expecting a big snowstorm soon, and our staff will be out there probably beating the postman to the door. But,
Yeah, you say you're out more than the postman.
yes,
Yeah.
yes, we are. And we have a full range of services. So we have nurses, we have physical, occupational, and speech therapists. We have social workers as well, home health aides, personal care attendants. I don't know if I've forgotten anybody, but we're there to help people be safe.
Okay.
So.
And Julie, I just want to talk to you about, you've told me before that when people are living at Fairview, you really get to know the people. You understand not only what their needs are medically, but who they are, what their personalities are like. How does that information get transitioned to Berkshire VNA?
Well, it's a great relationship that we have with the BVNA, because all the fine details that make someone feel welcomed and warm, we try to relay that to them so they can also use that information so when they go home, they're already known and they're already taken care of, you know, how someone likes their coffee, so to speak.
Mm-hmm.
Right. So, Nora, I'd like to ask, social workers help patients regain strength, certainly, and how do they do that?
Basically just encouraging and being there and, you know, keep pushing them along using encouraging words and making sure that their goals are met in order to go home.
Okay. What about you, Julie? What does that encouragement look like from you?
Well, we understand that no matter why they're in the facility, whether it's time for them to live somewhere else or an elective surgery or they had a traumatic experience, there's an emotional component to that. And we try to meet their needs in that respect. We understand that everybody does want to be home, and we do the best we can to get them home at the level that they were at or even at a better one if possible.
Great. So I want to hone in specifically on the program that has been developed between Fairview and Berkshire Visiting Nurse Association. So Pat, I want to find out how that program began.
Okay. We actually began talking about this back in the early fall. And through our health system, we were all from the hospital acute care piece all the way through long-term care and then home. We were all working with patients who have surgery for joint replacements, orthopedic surgeries for joint replacements, so a hip or a knee replacement. And we were looking for a way to make that transition as smooth as possible, making sure that we're all using the same care plan, that we're all really tuned into what the goals of the patient and the family are, and finding a way to best meet those goals. So we talked about how we could transition the services, so follow that patient from the time that they leave the hospital, whether they go directly to a long-term care facility for some rehabilitation or whether they come directly home. How do we share that information? And how do we prepare patients and families so that they understand what to expect, what kind of care to get in what setting, what kind of physical feelings they will have as a result of surgery or emotional feelings. So we just began putting together a constellation of services to help that person always be aware of what the next step of the plan was, and for the team that was taking care of that patient and family to always know what their expectations were and how we could best make them feel comfortable with the next step.
And I've heard you say too that residents in Berkshire County are just so fortunate to have access to the system of care.
It really is, because it starts at Berkshire Medical Center with their surgery itself. It's very nice to be able to transition them to Fairview Commons, who is another partner in that healthcare system, and then to be able to transition to Berkshire VNA, which is another partner in the system. So it's a full range of services, no matter what the physical needs of the patient are.
Okay. And Pat, I heard you mention before this care transition specialist who's in the building at Fairview. Can you tell us more about that?
Sure. It's part of the process that we've developed. This is a registered nurse whose actual focus is transitioning people from one level of care to another. One of the things that we've noted in the care of patients, we often talk with physicians who the primary care physician may not be aware that their patient is home and has had surgery. And that's because they refer them to an orthopedic surgeon for the hip replacement and then begin to lose track of them. Where are they? So this care transition specialist will meet the patient in the hospital, talk to them about what their goals are, make the primary care physician aware of what's happening, and letting that primary care physician know that our care transition specialist will keep them abreast of the patient's progress so that they have some sense of what's happening. And then they follow the patient, they introduce themselves and say, we'll be here when you're ready to go home. So they follow them to the nursing home. That is the person who works with Nora and Julie to make sure plans are in place for them to go home. That it gives some confidence to the family and the patient that it's a familiar face. It's somebody who knows what's happened to them every step of the way. And then that care transition specialist is also meeting with our staff back in the office who will be going into the home to take care of the patient. So it's a really nice segue into each step. And then even if they're followed by an orthopedic surgeon at home for the rest of their rehabilitation, we're keeping them in touch with their primary care physician so that they make that transition back to their own physician, and that physician has knowledge of what happened to them.
Seems very comprehensive.
It is. It is.
So Nora and Julie, what does the presence of Berkshire VNA in Fairview provide for the patients there?
The BVNA, this care transition specialist, has started attending our 72-hour meetings and just being an extra support system to the patients, the residents that are coming in for after surgery, and just being an extra support, which is nice.
And I know you had mentioned before that especially for residents who are at Fairview for short-term rehab, they can start to get apprehensive about going home. So meeting with somebody ahead of time probably makes them feel at ease.
It connects a face to a name and an agency, and it definitely makes them feel better, knowing that piece is in place before they're discharged.
And that relationship building is so important.
Relationship building is key to all of this. That's what gives the person comfort that there is somebody who will be there to help them every step of the way.
Great. So what we're going to do, we're going to take a short break to hear more about Fairview Commons, and then we'll be right back.
Nestled amidst the wooded and serene town of Great Barrington, Fairview Commons Skilled Nursing Center is minutes from downtown, in the heart of the beautiful and culturally rich Berkshire County in western Massachusetts. Fairview Commons offers you the best of both worlds. It's a locally run facility, staffed by dedicated healthcare professionals from the central Berkshire area. And it's backed by the expertise and resources of Berkshire Healthcare, the largest nonprofit long-term care provider in the area. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Fairview Commons is a proud recipient of the American Healthcare Association's National Quality Award. The Quality Awards recognize members' commitment to performance excellence by continuously demonstrating ever-improving value to residents and other customers. The Bronze, Silver, and Gold Awards recognize overall organizational effectiveness and capabilities and champion organizational and personal learning. At Fairview Commons, we pride ourselves on our deep commitment to our community. We offer a broad range of nursing home services, including short-term rehabilitation, skilled nursing, long-term care, hospice care, adult day services, and respite care. Fairview Commons offers a state-of-the-art, amenity-rich short-term rehabilitation suite for those primarily recuperating from orthopedic or cardiac surgeries. We proudly offer an elegant, home-like setting that allows our residents the comforts they expect while providing the care they need, including fine dining in our graciously appointed dining room, beautiful outdoor space, ample activities, and private family space. At the heart of it all is a focus on the body, mind, and spirit. Our rehab services include physical, occupational, and speech therapy. Our licensed therapy professionals help restore and maintain the body, by focusing on helping our residents improve strength and mobility in order to participate in the activities they most enjoy. These services are provided up to 7 days a week when ordered by a physician. Fairview is more than a place to live. It's a place to enjoy each day to the fullest. Our activities program focuses on the mind and spirit of our residents by offering engaging leisure and recreational activities, arts and crafts, music, discussion groups, exercise sessions, religious services, and cultural community outings and more. Each resident at Fairview Commons receives the highest quality care delivered by our dedicated staff members working as a team. From the nursing staff to our front office personnel, everyone is enthusiastic about the role he or she plays in the lives of the people who entrust us with their care. Our staff is committed to providing compassionate care, using teamwork as their guiding principle. We're dedicated to treating each person with dignity, recognizing their individual needs, goals, and preferences. We create a care plan for each person, focused on helping them achieve the highest level of independence and quality of life. At Fairview Commons, we're perfecting the art of superior care. If you or a loved one needs short-term rehab, extra care after a hospital stay, or a nursing-supervised full-time living arrangement, we invite you to tour and meet our staff. See firsthand how we enhance the lives of those we serve. To make arrangements or get more information, call 413-528-4560. We look forward to meeting you.
Welcome back. We are here discussing National Social Work Month for the month of March, and we are discussing specifically a collaboration between Fairview Commons and Great Barrington and the Berkshire Visiting Nurse Association. So it's a partnership that's benefiting patients in a lot of different ways. So I want to pick up with this concept of telemedicine, which is new for Berkshire County. So can you tell us about that, Pat?
Sure. This is a piece of equipment that we use with many of our patients. Even if they have orthopedic surgery, they may also have heart conditions or breathing problems. So this piece of equipment is about the size of a clock radio, and it just plugs into a phone line. And if there is not a phone line, there are little units that look like an iPad that patients can use as well. Those units can be attached to a wide-base scale, a little finger probe that measures your blood oxygen level and your pulse, a blood pressure cuff. And it's a way that we can help people learn how to manage their heart and breathing conditions better at home. The whole concept behind that is we get up-to-the-minute information in the office or wherever the nurse is located. They can actually look up this information on their laptop computers that they carry with them. And it's a way to really help patients get used to new habits that will help them stay healthy. For example, if you have a heart condition, very often the best thing a patient can do is weigh themselves every day. So they can get on the scale. We actually see what the weight is from our computers or in the office. We can tell what that oxygen level is. And we can often become aware of symptoms before the patient is actually feeling the symptom. For example, if their weight goes up dramatically, 3 to 5 pounds in a day, they may not be having breathing problems yet, but they will the next day. So we can make contact with them and with their physician, change a medication, change a treatment to help them stay healthy and not have that sickness get worse and require hospitalization.
Okay, so it sounds like that has had a huge impact on keeping people.
It has.
Yeah.
It has.
Yeah, great.
So.
So I want to come back to the concept of the 72-hour meeting. So Nora, what is that? I know you had mentioned that before, and how does that help patients? What is discussed at that meeting?
It's a meeting that's held 72 hours after admission, and it consists of the social worker, the rehab staff member, the nurse manager, and activities. And they come in and we go over goals that we've established for the patient, and we just talk about what the patient expects from us and see how their stay is going.
And Berkshire VNA has now become a part of that meeting, which
Berkshire
is
VNA they come to all the 72-hour meetings.
That's great.
Yeah.
Yeah, just another example of that great collaboration. And so another example of a way that sounds like you're collaborating is with respite care. So respite is a good example of a service that works for patients but requires both Fairview Commons and Berkshire Visiting Nurse Association to work together. So can you let us know what that looks like from your perspective?
Sure. Again, the staff people that are working with the patient and the family may see that someone is either would like to plan a vacation, needs a break from the care. Caregivers are often the same age as the patient, might have health problems of their own. It's a 24-hour a day care. And as much as they have a loving relationship with their family member, everybody needs a break once in a while. So our staff people can talk with the care transition specialist who will work with the staff at Fairview Commons to make arrangements for a brief stay at the facility so that a family member can take a vacation, take a few days off, have a break.
And so having Fairview Commons involved is just another way to provide that support for family members.
It keeps people at home longer. A caregiver is much more able to continue providing all of that service for a much longer period of time if they can get planned breaks.
Great. And then Julie, then you get the call, and what happens from your end?
We receive a call from the BVNA saying that this person does need a respite stay for various reasons. Some people are going on a family vacation or a wedding. We do get someone who's there every year for about 5 days because their family does go on vacation and needs a break. I try to do a lot of caregiver training when these people do come in because oftentimes they carry guilt about bringing their loved one in, even if it is just for 5 days or so. Educate them that they may fail in health themselves while they're taking care of their loved ones. So educating them on that. And it's great to pass them back home to the BVNA where I know they're going to be taken care of there.
Pat, I've heard you describe it's like putting your own oxygen
Right,
on first.
if you were taking a plane ride and God forbid something happened and the oxygen comes out, they always tell you to put your own oxygen on first before you help your child, or the person next to you. And that's the same thing here. We're giving people a break so that they can continue to provide the great care that they do.
Great. Great. So I want to finish with, I know we can't use names, but I'd really like to hear the story of a patient who's doing better, who had a good experience because of the collaboration between your two agencies. So Nora, do you have a story for us?
Yeah, we had a gentleman who was living alone and falling a lot and not doing so well. He was admitted to us from the hospital, very weak. He was with us for about 2 months. Worked with therapy 6 days a week, got stronger, and he went home with the Berkshire Visiting Nurse, and he's been home since the end of December,
Right.
doing well.
Yeah. This is a person who was a little bit younger than the normal resident who is at Fairview, is a businessman, and had a neurological problem, Parkinson's, and how difficult that is to maintain as the disease progresses. So there was a lot of work done to strengthen and use assistive devices. And we're very happy for him that he's where he wants to be. And it was from the middle of December until now. So it's about a month and a half. This person has been home, and it's a very successful thing because there were many trips to the emergency room and other places before this. So we're very happy for him.
And he wanted to go home, so we're glad that we were able to make that happen for him.
And it was because of that collaboration and
Right.
that working together that
Right.
his services were all lined up for him. That's great.
Yep.
Wonderful. Well, thank you, ladies, so much for being here today, and happy National Social Work Month.
Thank you.
This has been InfoSource, a presentation of Berkshire Healthcare Systems.